Hello, let's learn about isolation precautions. We'll be learning in this session about standard precautions and transmission-based precautions. Let us understand what is standard precautions. There's a basic practices that should be applied to all patient care, regardless of the patient's suspected or confirmed infectious state, and applies to all settings where care is delivered. These practices protect the healthcare professionals and prevent the healthcare personnel or the environment from transmitting infections to other patients. They are the best work practices to achieve infection control and are able to include hand hygiene, respiratory hygiene, appropriate personal protective equipment, safe ingestion practices, environmental cleaning, patient equipment cleaning, safe handling of linen and waste. Now, what are the standard precautions that are designed to do? Their purpose is to primary is to prevent healthcare associated infections in all hospitals, patients, and clients attending the healthcare facilities. They reduce the risk of transmitting microorganisms from known or unknown sources of infection. Then provide rationale for appropriate use of limited infection prevention resources in caring for all patients and clients. There are the key IPC strategies to prevent and limit transmission, and the elements of standard precautions include hand hygiene, respiratory hygiene, appropriate personal protective equipment use, safe injection, environmental cleaning, patient equipment cleaning, safe linen handling, waste management. Let's talk about hand hygiene. Hand hygiene remains the most important infection control measure to reduce the transmission of infection. There are 5 moments where hand hygiene should be practiced, and this includes before touching a patient and after touching a patient, before and after any activities that involve blood and body fluid, and after touching a patient's surroundings. Now, how to hand wash, how to hand rub. So there are evidence-based practices that are recommended. Hand wash should be done for 40 to 60 seconds, while hand rub should be done for 20 to 30 seconds. And hand rub should be alcohol-based with either 60% ethanol or 70% isopropanol. And 7 steps should be followed for the hand wash or hand rub. That is, first is palm to palm. As you can see from this slide, first is palm to palms, then palms to the dorsum and vice versa, then palm to palms with the finger interlaced, then clasped fingers will do the opposite palms, then rotation rubbing of the thumb to the opposite palms, and the clenched fingers will do the opposite palms, and finally the wrist. And finally, it should be dried with a paper towel or tissue paper. The respiratory hygiene should be followed at all times. That is, cover the mouth and nose with your bent elbow or tissue when you cough or sneeze. And after coughing or sneezing, the tissue paper should be discarded into the biomedical waste bin. Healthcare facilities should aim for physical distancing of at least 2 meters in common waiting areas for patients with acute febrile respiratory symptoms. Post-visual alerts at the entrance to healthcare facilities should be in place. Make hand hygiene resources, tissues, and masks available in all common. The appropriate PPE usage includes gown, mask, apron, goggles, gloves, and other things. And they should be guided by risk assessment and the extent of contact anticipated with blood and body fluids. So, and the other thing is safe ingestion practices. Inappropriate sharp management exposes the healthcare workers and come to the risk of injuries, which again further could transmit infections like hepatitis B, C, and human immunodeficiency viruses. So there are 7 steps of WHO to conduct safe ingestion practices, and this include hand hygiene, sterile vial of medication, and dilute and appropriate collection of. So the safe ingestion practice, the other important thing element of standard precautions, environmental cleaning, is equally important as hand hygiene and safe ingestion practices, wherein there should be adequate procedures for the routine cleaning and disinfection of environmental and other frequent touch surfaces. The cleaning should be performed with appropriate disinfectant following manufacturing. The patient equipment cleaning should be done when it is soiled with blood and body fluids with appropriate disinfectant as per the decontamination protocol of the hospital or the healthcare settings. Then safe linen and laundry handling should be done. Handle the transport and process used linen in a manner which prevent the skin and mucous membrane exposures and contamination of clothing and avoid transfer of pathogen to other patients and the environment. Linen handling may be a less applicable model for the outpatients. Regarding waste management is another key element of standard precautions. That there should be minimizing of the waste, that it should be segregated appropriately as per policy at the start of generation. That is, collection, storage, and transport should involve infection control measures, so there is no threat or the risk of transmission of the hospital-acquired infection to the patient, visitor, and the hospital healthcare professionals, and it should be treated and disposed as per protocols of the Pollution Control Board. Human tissues and laboratory waste that is directly associated with specimen processing should be treated as clinical waste. discard single-use items. So that is about biomedical waste. This include contact precautions, droplet precautions, and airborne precautions. Based on the mode of transmission, risk of transmission-based precautions should be followed at specific level of infection control, and that's to be used by staff for specific patients according to the mode of. So this is contact precautions involves gown and gloves along with hand hygiene. Then droplet precautions include wearing of mask whenever the contact with patients is involved who is infected with droplet infections like diphtheria, pertussis, meningitis. Then airborne precautions include where the healthcare professional wears an N95 respirator and the patient is instructed to wear a mask, and the patient is in turn isolated into a negative ventilation room. That is the most important measure in all the transmission based precautions and contact precautions. It is more vital along with the wearing of gown. Private room should be available for the patient infected with the contact infections like burns, boils, infections, infection with drug-resistant organisms. Gown and gloves should be worn while entering the room, and change the gown and gloves after contact with the infectious material. Limit the transport of patient to essential purposes only. Use non-critical care equipment with one patient only if possible, and single rooms are not available. This is done for contact precaution done for COVID-19, MRSA, VRE, hepatitis A, norovirus, and infectious pathogens. Now again to repeat, this includes gown, gloves plus hand. Now for droplet precautions, this includes the transfer of pathogens by large droplets, and due to the size and weight of these larger particles, they do not travel far in the air but remain immediately followed over the floor and become non-viable. Hence, the droplet precaution involves wearing a mask for patients with around 3 feet only. There should be a private room for the patients infected with droplet infections like diphtheria, pertussis, meningitis. Ensure at least 2 meters spacing between the patients, and wear medical masks if within 2 meters proximity of patients, and limit the transport of patients to essential. Airborne precautions occurs by droplet by transfer of pathogen less than 5 microns in diameter. They remain suspended for longer duration and can be disseminated into air currents in a room. So this occurs during breathing, coughing, sneezing, infections like tuberculosis, measles, chickenpox, and others. Private rooms should be available and should be closed at all times. Room air should be exhausted outside using negative pressure or negative ventilation. N95 respirator should be worn by the healthcare professional while entering the patient's room, and limit the transport of the patient to essential purposes. It's followed in airborne infections like measles, chickenpox, involves N95 respirator by the healthcare professionals. What are the guidelines to improve personal safety in the healthcare environment through appropriate and selection and usage of PPE should involve proper correct sequence of specialized clothing or equipment worn by employees such as per recommendation OSHA should training and administrative controls, engineering control, work practice control, and personal equipment controls should be among the hierarchy of health setting. Now, factors that influence this PPE selection depends upon the type of exposure, such as splashes and category of isolation precautions and durability and appropriateness for it. The type of PPE in the healthcare setting includes gown, gloves, mask, and respirator, goggles, face shields. We'll see about the details about the PPE in my next session. Thank you.